The motion is agreed to.
One key vote down.
For weeks, we've been debating legislation that will...
Much more debate to go before Thursday's final vote on the U.S. Senate's version of health care reform legislation.
This legislation is not about politics or partisanship or some poll that appears in a newspaper someplace around the country. The legislation is really about people.
Still, Senate Democrats said they're more confident the nearly $900 billion package will eventually become law. On Monday, the U.S. president said the bill would improve Americans' standard of living.
Many people recall the enormous fights around the Patient's Bill of Rights that never got done. Well, you know what? The Patient's Bill of Rights is embedded in this health care bill, and it makes sure that all Americans who have insurance right now are getting a fair deal from their insurance companies.
The Senate version of health care reform would include the following. Nearly all Americans would have to get health insurance. Insurance companies would have to cover all subscribers, regardless of any pre-existing health conditions or illnesses. And the bill would create so-called exchanges set up to help people shop for affordable coverage and benefits.
Thank you so much.
The idea is to make it easier for people to get preventive health care and to reduce the cost of medical care over time, one of President Obama's top goals.
For all those who are continually carping about how this is somehow a big spending government bill, this cuts our deficit by $132 billion the first 10 years and by over $1 trillion in the second. That argument that opponents are making against this bill does not hold water.
This debate is not over. There's still a chance to vote against this bill.
While all 40 Republicans attack the bill on both financial and moral grounds.
There is time for truly pro-life senators to stand tall and say no. There is still time for principled senators to reject the carve-outs and to cast aside the bad backroom deals.
The White House is trying to prevent a policy dispute from ripping the Democratic Party apart. Progressives say the Senate plan still gives private insurance companies too much freedom to charge what they want and not enough competition in the form of a government-run insurance plan. But more conservative Democrats say they're simply being pragmatic and say everyone should be focused on expanding health coverage to more than 30 million people.